Hey, are you curious about being a nurse in the operating room? It's pretty cool. So, I'll let you in on a couple of secrets. Here's 5 reasons why I became an operating room nurse. The first reason is I love Grey's Anatomy. I don't know how many times I could say that I loved Grey's Anatomy, but I do. Even though the show has gotten a little bit more dramatic and less scientific over the years, it was just something about just watching the surgeries on those shows that just really spoke to me and made me curious about the operating room. The environment is like no other place I've ever been to. Everything is sterile, and it's just, I don't know, you just, now I'm making you curious. You just got to check it out. The second reason why I was interested in OR nursing is I enjoy immediate gratification. There's just something about having a patient who has an illness or some type of trauma. You wheel them back into the OR, the surgeons and the whole team, and everybody gets to working on them, and then by the time they roll out of the OR, we've fixed it. And you can't really easily see such a dramatic change like that somewhere else outside of the OR. So that was definitely something that interested me, just to be able to see actions happening in real time. The third reason why I went into OR nursing is the team-based approach. In the OR, there's so many different people from different disciplines that are all working together to take care of one patient. And it's amazing to see everyone work together in tandem on different tasks just to make the surgery and the whole entire perioperative process a success. I feel like it's hard to kind of see that in other places. Sure, on the floor, you may see a little bit of that interaction during rounds between the physicians, the nurses, respiratory therapy, physical therapy, social work, pharmacy, and the nursing staff. But after the rounds is over, poof, it's gone. But in the OR, every time we roll a patient in, there's a team assembled from the nursing staff, as well as the anesthesia staff, as well as the surgical team, and we also have vendors and representatives, as well as the perfusion team, who all come in. We all work together to help fix patients and help make them better. And sometimes we even have other specialties come in, like urology or cardiology, that come and assist us with different cases as well. The fourth reason why I enjoy being a nurse in the operating room is that there's 2 different roles. Well, really, there's probably more than 2 different roles, but 2 main roles that you can play here, or you can just do both like I did. So the 2 different roles are that you can be an OR circulating nurse, who you go and interview the patient, you check their medications, check their history, and you help assist with getting the patient into the room, getting them settled, monitoring them throughout the case as well as their safety, and then charting, documenting everything that happened and went on, and then passing on report to the post-anesthesia care nurse. The other role is a scrub nurse, which is sometimes also fulfilled by a surgical tech. But as a scrub nurse, you're able to set up all the instruments for the case. You pass the instruments back and forth with the surgeons or the physician assistants or the residents or anyone else that's scrubbed in during the case. And so you're right there at the site of surgery, and it's exhilarating just to be there, to be able to watch and see everything that's going on. It's such a great learning experience as well. And so those are the 2 main roles within the OR for nurses. You can also become a charge nurse who helps direct where staffing should go, how cases should go along, and you can get more into that role with the more experience that you have as an OR nurse. And you can also become a team lead or manager, or even moving up in the clinical ranks of nursing within the OR. So that way you have a little bit more leadership and a little bit more managerial experience as well. So there's different places, even within the OR, for people to go and get involved with. The fifth, last but not least, reason why I enjoy OR nursing is that you're able to go and speak to a patient that you've never met before, and for about maybe 5 or 7 minutes, you get the opportunity to build trust with that patient, to ask them a little bit about them, and that way formulate a good idea of what things do you need to have prepared for the case, how can you best assist them through this whole surgery experience, and what are the things that you should look out for and prepare for just in case things don't go as well. It's something about just having that ability to have a quick conversation with someone at one of their most vulnerable times in their life and be able to build such a large amount of trust with them that, you know, you're the one that's responsible for them when they're laying there on the table during their surgery. You're their voice, you're their advocate. And so it's something about being able to step up and step outside of yourself to be there for someone else when they can't be there for themselves. That is just such a rewarding experience that words just can't even really describe. So with that, I hope that this kind of gave you a little bit of insight as to why I became an OR nurse, and maybe this might help you as well on your path to OR nursing. If you have any more questions about OR nursing, please feel free to leave a comment below. Make sure you like and subscribe, because I'm sure you're enjoying all this great content and you just can't wait to get more. But yeah, please let me know any of your thoughts, and do you feel the same way about OR nursing, or do you not feel the same way about OR nursing? Just let me know. I'm curious.